So our event today is a webinar called Beyond the Buzz, a dual approach to tinnitus relief. And we have two guests with us, Karen Vincent and Karla Tucker. And we dedicate this webinar to the memory of Brian Marshall, who recently passed, and he worked with us on a lot of tinnitus and Meniere's disease related programs and services. So we want to acknowledge his memory this way. So our first speaker is Karla Tucker. She's an audiologist and the owner of Maico Hearing Services. And I'll just give a brief introduction. Karla graduated from Western University with a master's degree of clinical science in audiology in 2010. After graduating, she pursued training in tinnitus retraining therapy and returned to her home province of Newfoundland and Labrador to practice at her family's hearing clinic, Maico Hearing Service. She loves working with people and always inspired by their stories about how their lives have changed after hearing and tinnitus treatment. And she genuinely cares about her patients and will go above and beyond for each person she works with. And in her spare time, Karla enjoys traveling, watching movies, reading inspirational books, and spending her time with family and friends. And in fact, Karen shared with me she was one of Karla's patients, so maybe she can share a little bit of her personal experience with Karla as well. So welcome, Karla, and I am passing it on to you now.
Thank you so much for having me. This is a topic that I really enjoy sharing and speaking on. I am very passionate about it. I have tinnitus myself and have really enjoyed working with my patients to help with tinnitus over the years. So I'll give a little bit of an introduction and background about what tinnitus is first. Tinnitus is sound heard by an individual in the ears or the head, and it can be any number of different sounds. Everyone's experience with tinnitus is a little different, but some of the most common sounds that are heard are ringing, buzzing, static or a rushing sound, screeching, whistling, and roaring. And a lot of people actually experience more than one sound. My tinnitus, I hear roaring sometimes ringing, but there are people who experience a number of different combinations of sounds, and it can change over time and from day to day as well. And tinnitus is not related to an external sound source, so it's only heard by the individual themselves. So if it's a sound that a doctor can hear, for instance, with a stethoscope or something close to the ear, that would be another type of ear sound, like a somato sound that's related to blood flow or heartbeat or some type of physical condition. So the tinnitus we're referring to, it can't be heard by anyone else. It's often referred to as a phantom auditory perception. So some of you might have heard of phantom limb syndrome. That's when someone's lost a limb or had an amputation. They might report afterwards that their leg is paining, or they're experiencing some type of pain or discomfort from the limb that's been removed. So tinnitus has often been referred to in that same way. There's no physical sound present, but in the absence of sound being generated externally and sent to the brain, the ear often makes up some of its own sounds so that you get that perception of sound. Tinnitus is often accompanied by decreased sound tolerance. So if you've heard of hyperacusis, that would be the main decreased sound tolerance that we see. So that would be when a person is more sensitive to certain sounds or louder sounds than other people are. And one example of that would be, misophonia. That would be if someone has a very strong dislike or even a hatred for a certain specific sound or type of sound. And it can evoke a very real and strong emotional response. So when we see misophonia, it's often associated with a very specific sound, for instance, chewing sounds. And it can even be as specific as a certain person's chewing sounds. So someone might be able to tolerate other people's chewing, but maybe a specific family member or friend just evokes that kind of response. Another type of decreased sound tolerance that we see is phonophobia. So that would be a fear of sound or anxiety surrounding a certain sound. And we often see that when people are anxious about experiencing pain or discomfort when they're exposed to that sound. Or it may be associated with a fear that a condition they have, such as hearing loss or tinnitus, might become worse if they're exposed to certain sounds or louder sounds. Tinnitus, it's not a disease. A lot of people think that tinnitus is a disease, but it's actually a symptom of an underlying problem like hearing loss. And there are many potential causes for tinnitus. So tinnitus is frequently associated with hearing loss. While you can experience tinnitus with normal hearing, the majority of cases we do either see some hearing loss or there may be some underlying damage to the little delicate cells in the inner ear, even if it's not significant enough to show up on a hearing test yet. Noise exposure would be the biggest factor associated with tinnitus. We see that all the time. That's the number one cause of tinnitus is noise damage. Meniere's disease, that's another one that's frequently associated with tinnitus. So that's a buildup of fluid in the inner ear, and it's a disorder that's characterized by 4 different symptoms. You must have hearing loss, tinnitus, vertigo or spinning sensations, as well as a feeling of fullness or pressure in the ear. And those are the main characteristics that define Meniere's disease. Another issue that we often see associated with tinnitus is ear infections or earwax. Anything that's going to reduce how much sound your ears are sending to your brain can certainly be associated with tinnitus. The good thing, of course, with ear infections and earwax, it's, once that's treated and taken care of, then the tinnitus subsides. Otosclerosis is another disease of the ear in which you have a bony growth develop in the middle ear, and that's often treated with surgical procedures that an ear, nose, and throat specialist can perform. Certain drugs and medications have also been associated with inducing tinnitus, particularly some drugs associated with treating cancer like chemotherapy or really high doses of antibiotics has been associated with tinnitus. Not the dosages that you would take for just treating an ear infection or what we typically see, but it must be really high doses. And even certain over-the-counter medications like aspirin, if it's taken in really high doses, it has been shown to cause tinnitus. The interesting thing about aspirin, though, as soon as you stop taking that high dose, the tinnitus does subside pretty quickly. Head injuries is another one that we see as a cause of tinnitus, particularly if the part of the head that was injured is associated with the ear, or those delicate little hair cells that are in the inner ear. And lesions and growths is another one. That one we see a lot less often. We certainly do, do a thorough assessment when we see tinnitus, but the chances of there being something like a lesion or a growth that would be causing tinnitus is very, very slim. In terms of the prevalence of tinnitus, it's actually a lot more common than people realize. We have some Canadian statistics that we obtained from Statistics Canada. In 2019, approximately 37% of adults reported that they experienced tinnitus. So if you think about it, that is quite a lot, almost 40% of our population. And that's what we know of. That equates to about 9.2 million people. So it's very, very common. The good thing is that out of the adult Canadians that were surveyed, it was only 7% that reported to have bothersome tinnitus. So that's, it's very possible to have tinnitus and not have it bothersome, not have it affect your life, not have it a problem for you whatsoever. And tinnitus is very common among people with hearing loss. As many as 70 to 85% of people with hearing loss experience tinnitus. So it's quite common among that population for sure. In terms of tinnitus severity, the way we categorize how severe tinnitus is, it's not based on how loud it is. It's not based on whether it's constant or intermittent or whether it affects one ear or both. It's how it's affecting your everyday life. That's how we categorize the severity of tinnitus. So typically to do that, there's a series of questionnaires that are available that are used to assess how severe and how much of an impact tinnitus is having on an individual's life. And the one that we use most commonly as audiologists, it's called the Tinnitus Handicap Inventory. And that categorizes tinnitus into 5 main categories. So there's slight, mild, moderate, severe, and catastrophic. Typically with the slight and mild cases, these individuals are coping fairly well with the tinnitus. It may still be bothersome at times, but it's not having a major impact on their life. And those categories are certainly much easier to treat and work with in terms of the time that is involved in seeing improvements. Oftentimes, if there's a hearing loss present, just treating the hearing loss with hearing devices or whatever treatment may be required for that loss is sufficient to improve the tinnitus in those cases. If you have moderate tinnitus or worse, We still would recommend things like treating your hearing loss, enriching your environment with sounds as much as possible. Safe levels of sounds, of course, not excessively loud sounds. But oftentimes those moderate cases and worse require a little bit of extra work and more intensive treatment to really see significant and long-term improvements. I'll just go through a few of the tinnitus treatments that are available. Like I'd mentioned earlier, hearing aids is a big one, and just giving your brain back those sounds that it wants to hear can really reduce and lessen the prevalence of tinnitus. And tinnitus masking is another one that's commonly used. That involves the use of some type of a sound. Um, may be administered through on-ear devices that you can wear throughout your day to hear some background sound, like a white noise or an ocean sound or something like that. Or it could be something that you use at night, particularly if tinnitus is affecting sleep. There are a lot of different nighttime maskers and tinnitus machines that are available for nighttime use as well. Cochlear implants, that can be very effective as well. You would not use that as a treatment for tinnitus only, but if your hearing loss was significant enough that hearing aids aren't effective and a cochlear implant is recommended, then that can certainly improve tinnitus as well. In terms of medications, there's no real medication or magic pill available for treating tinnitus, but some people have found that certain medications that can improve anxiety, depression, those types of conditions can really help to alleviate and improve tinnitus as well. Surgery, again, there's no specific surgery for tinnitus, but if there is a surgical procedure that can, repair damage to the eardrum, repair damage to the little bones in the inner ear, or any type of surgery of that nature, then that can also improve tinnitus as well. Tinnitus retraining therapy, or TRT. That's one that I work a lot with. When I was in school as an audiology student, that's ironically enough when I developed tinnitus myself. And I had an opportunity then, anytime I was able to select an assignment to study or something to present on, I always chose some type of tinnitus project so that I could research it and learn more about it. And throughout my audiology program, my research kept bringing me back to TRT as being something that's been around for a while and has been proven to be very effective. That one uses a combination of sound therapy that's specifically measured and tuned for an individual, and counseling as well. Both sound therapy and counseling separately are effective at helping to improve tinnitus. But for significant tinnitus, that combination of the two realms that TRT brings together has been shown to be very effective for the long-term treatment of tinnitus. Cognitive behavioral therapy, that's another option that actually works nicely in conjunction with TRT. And that would be a form of psychological treatment that's used to treat a number of different problems, including depression, anxiety, or even substance abuse and eating disorders. But the focus is on changing thinking and behavior and providing coping strategies to improve an individual's symptoms over time and really works to improve quality of life. Stress management and meditation is another great option that can be very important for treating tinnitus. A lot of people come to me and say, my tinnitus is really causing me so much stress and anxiety, but often it's the other way around. Often it's underlying stress and anxiety that is actually causing the tinnitus to be noticeable and bothersome for an individual. So improving stress is huge when it comes to the treatment of tinnitus. And that might be as simple as, incorporating exercise into your life, improving your diet, looking into things like massage therapy or acupuncture, or it can involve more focused mindfulness meditation, which is something that Karen is going to get into and explain further later in our presentation. And another treatment that I've been asked about lately. It's an experimental treatment. It's called Linear, and it uses electrical stimulation delivered to the tongue, as well as acoustic stimulation played through headphones or earphones. The early research does show that it can work to reduce the loudness of tinnitus over time through neuromodulation, or basically changing the way that your nerves carry information to and from your brain. So this technology does show some encouraging results, but it doesn't appear to have any better results than current tinnitus treatments, such as tinnitus retraining therapy, and it's not yet approved by Health Canada. There are some other countries that have approved it, but it's not yet something that is available in this country. So I'm just going to go in a little bit more detail about tinnitus retraining therapy, since that's what I work the most with. So like I mentioned earlier, sound therapy is a big component of this treatment. And the purpose of the sound therapy is to decrease the contrast between the tinnitus and the background. So if you think about a candle, if you have a candle lit in a dark room, it's going to be noticeable to you. You're going to see it clearly. But if you light a candle outside on a bright sunny day, it's not quite as noticeable to you. So that's the idea behind sound therapy. And the way that we use sound therapy in TRT, it's a very specific method of measuring and using the right amount of sound. With TRT, we don't want to completely mask or cover up that tinnitus sound. We just want to give the right amount of sound therapy to the ears so that we're just taking the edge off the tinnitus, so that over time, the brain can just learn that tinnitus is an unimportant little sound, just like your refrigerator running in your kitchen or your heat pump or your furnace. It's something that, you often don't even hear or notice. And if you do notice it, it's not something that's bothersome to you. So that's pretty much the goal of tinnitus retraining therapy, is to get you to that point where you're not noticing the tinnitus, it's not bothering you. It's just like your refrigerator. And one of the ways that we deliver sound therapy is through those on-ear sound generators. Very similar to hearing aids. They're very small and comfortable and discreet nowadays. But as I said, the volume must be measured and set appropriately. If it's too low, that's not effective and could even potentially aggravate the tinnitus. If it's too high, it could have the same effect. Or it could just work like a band-aid. If you're covering up the tinnitus with sound, as soon as you remove that sound, it's going to be just as loud and noticeable to your brain as it always was. So it's not a long-term treatment if you're using sound therapy in that way to completely mask or cover up the tinnitus. The other way that we deliver sound therapy and TRT is through hearing aids. Depending on the hearing loss, that might be our main focus for delivering sound to the brain. And sometimes if someone has hearing loss and tinnitus, we will work with certain combination devices that will deliver extra sound so that people can hear better. We'll treat their hearing loss, but we'll also have a background sound therapy running to treat the tinnitus as well. The tabletop sound generators are great for, like I said earlier, nighttime. If you're having any issues at sleeping, or even if you're not, just to give your ears a little bit of stimulation at night can be really helpful for improving tinnitus over time and in general. And there are a lot of smartphone or apps you can get on tablets now that you can choose from a variety of different sounds. And you can use this in the day as well. Nighttime is most commonly when these tabletop machines and apps are used, but you can certainly have this on during the day if you want a little bit of enrichment of your sound environment in the daytime as well. Typically, the sounds that we recommend that are most effective are sounds that are neutral or relaxing and fairly steady, particularly when you're sleeping. So sounds coming from the television or radio are typically not recommended because they can fluctuate, and it can be distracting to sleep in particular if you're using it at nighttime. And household sounds as well. Just, if you're home alone, just make sure that you have the TV on in the background or a radio or a fan, just something to give your ears a little bit of stimulation is very, very helpful and recommended when you're in the TRT program. And in terms of the counseling component of TRT, we do meet regularly with our patients throughout the course of the program. And we do focus a lot on education about the tinnitus, because the more that people understand that it's not a dangerous disease and that it improves over time when you're treating it, doesn't typically get worse. That's not the nature of tinnitus. Hearing loss can unfortunately become worse over time for some people, but tinnitus, once you get a handle on it and once you retrain the brain to stop focusing on it and stop amplifying it, it really does improve and decrease over time. And that's one of the things that, we're often having to do is educate people about that and reverse any negative counseling that they've received, because sometimes people have been told that there's nothing they can do about their tinnitus, or they just have to learn to live with it. And that can be really damaging to hear, that you might feel like really hopeless, and that can just increase your anxiety about it and just cause it to become more bothersome. So just making sure that people really understand tinnitus and that it does improve over time, and that notion that there's nothing you can do about it, that's an older way of thinking. And today there are things that can be done, and there certainly is hope. In terms of TRT success rates, people often ask me about this, how successful the treatment is. There have been a lot of studies on TRT because it has been around for quite some time. It started back in the 90s. And the studies have shown over 80% of cases have shown significant improvements. And results of studies over longer periods of time, such as 5 years, showed that the improvement is persistent and that the TRT is a highly effective treatment. And I would say, just from my own personal experience, I've been doing this now for 14 years. And I would say that sounds about right. I would say that at least 85% of our patients do see very significant and long-term improvements in their tinnitus. So usually if someone doesn't see improvement, they're in the minority, and there is a reason for that typically. So just a few take-home tips I'd like to share. Number one would be to avoid silence. You really do want to enrich your environment with sound whenever possible, whether that be through sound generators, hearing aids, or household sounds. Reduce stress is a big one. You really want to take care of yourself and do whatever you can to manage stress and anxiety. You want to protect your ears from excessive noise or loud noise, but at the same time, avoid overprotecting your hearing. You certainly don't want to wear earplugs or cotton balls in your ears as you go about your day-to-day activities. That can just make hyperacusis and tinnitus worse. And just remember that you don't have to learn to live with it. There is hope, and there are programs and treatments available now. And if you or someone you know is experiencing bothersome tinnitus, seek help for sure. That's important. Don't just try to cope on your own. There's help available.
Thank you. Thank you, Karla. That was wonderful. It was a great presentation. We see a lot of patients with tinnitus coming through our door. And as you mentioned, a lot of the time from medical professionals, they hear that there's nothing to be done. And it usually means that there is no medical treatment for it. You know, there is no pill you can take or surgery you can have that takes it away. So it is devastating to let people know that there is nothing they can do. And it's great to have a place to send them where they can have some relief and some help. Can you just reiterate what kind of help they can receive from Maico Hearing Service? What exactly do you offer out of all those options that you outlined?
So again, the TRT is one thing that we really focus on. And right now we're the only clinic that is offering that in the province, but we do have our main clinic locations in St. John's and Grand Falls and Corner Brook do offer TRT. Our Gander Clinic and Harbor Grace clinics don't as of right now, but at least there are those centers across the province where we offer TRT. We do offer hearing aids, combination devices, and sound generators, including the tabletop ones I mentioned for nighttime. And there are some other specialty items as well. If you're trying to use some sound therapy at night and you're sharing a bed with a partner who might not enjoy your sound therapy, there are different options like little soft headphones that wrap around your head or pillow speakers and things like that that are available as well.
So, our next presenter is Karen Vincent, who is a certified mindfulness and meditation teacher here in St. John's. And she received her certification through the University of California, Berkeley. She has been studying meditation for over two decades, attending retreats across Canada, United States of America, and Southeast Asia, and has maintained a daily practice for more than 11 years. Karen experienced a sudden sensory neural hearing loss in 2022, and that's where she got tinnitus as well. So she knows from personal experience what she's talking about. Her deep-rooted mindfulness and meditation practices were crucial in helping her regain her sense of peace and well-being, enabling her to re-engage actively with both her personal and professional life. Combining her extensive background in meditation and her personal experience with hearing loss and tinnitus, Karen now offers specialized mindfulness and meditation programs. And these programs are tailored to individuals with tinnitus and in discovering effective ways to enhance their quality of life. And she will tell us more about those programs right now.
Thank you, Marta. And thank you so much, Karla. Yeah, I'd like to start, first of all, Karla, by saying thank you so much. I wasn't actually a patient of yours. I was a patient of one of your associates at Maico Hearing Clinic when I started losing my hearing, when I had sudden sensory neural hearing loss. I went and I got a baseline audiologist test or hearing test, and this showed that there clearly was a problem. At one point during those early days, I had a very, very dark day, and I tried to get a hold of my audiologist, and she wasn't in that day, and you kindly called me back and talked me in off the ledge. And the words that you said to me gave me hope to be able to get through those early days. So I'd like to thank you for that. Yes, so I am a certified mindfulness and meditation teacher, and I've also had a daily formal meditation practice for over 11 years. So what that means is every day I sit for between 30 minutes and 45 minutes in meditation. So clearly, I'm a highly enlightened being. At least I was until January 22, when this hearing loss occurred out of the blue. And shortly after we realized that I had lost my hearing, I developed what I considered to be a catastrophic case of tinnitus. So for me, mindfulness and meditation practices have helped me through all kinds and sorts and degrees of difficulty throughout my life. Well, at least in the last couple of decades, but they literally saved my life when this particular health situation came up. So again, thank you for that, Karla. 15 minutes is next to impossible to explain mindfulness and meditation in general. So what I'm going to do is I'm just going to essentially stick to the basics in terms of how they relate to dealing with tinnitus. So we'll start, first of all, with a couple of very simple definitions of mindfulness and meditation. So mindfulness is non-judgmental awareness. And what this means is that we are aware of what is going on within ourselves and around ourselves at any given moment. And we're not judging whatever that happens to be, either good or bad or right or wrong. And so what we're doing with this non-judgmental awareness of all the different things that are happening in our moments is finding some balance and some peace in this non-judgmental middle ground. So mindfulness is non-judgmental awareness. Another definition of mindfulness is knowing what your mind is full of. And what this means is that we become aware of the constant stream of thoughts that are going through our head and the tone behind them, how they make us feel, how they're showing up in our life, and the consequences of our thoughts. So in mindfulness meditation, we're sitting and we're learning what our mental habits are, how we tend to think about things that are going on in our life. But we also are learning whether these thoughts or these mental habits are helpful or not. And so the meditation part of mindfulness is the training ground in this non-judgmental awareness, in this ability to know what your mind is full of. As Karla mentioned in her presentation, meditation, stress management and meditation can be very helpful in learning how to live with or cope with tinnitus. So you might be one of those many people that were told wrongly that there's nothing you can do about tinnitus. You just have to learn how to deal with it, how to live with it. And I was told that, and that was one of the biggest sources of stress for me. I felt like, oh my God, how can I possibly learn to live with this? And why would I want to, right? It's that type of thinking that causes problems. The biggest obstacle to learning to live with tinnitus is the thinking mind. With mindfulness meditation, we sit in meditation, we start to recognize those habitual thinking patterns that are making whatever is happening in our life, especially tinnitus, more difficult than it needs to be. We see that through the mind, through no fault of its own, because it's kind of built into our DNA to constantly be looking for danger and to think about things in a negative way. We have a negativity bias, the mind does. So in meditation, we start to see that if we leave the mind unattended, it will stress us out with stressful negative thoughts about what's happening in our life. And this is certainly the case when something like tinnitus happens. So as far as tinnitus goes, and although we know that after a medical consultation that the sounds that come from tinnitus are not actually harming us, they are very upsetting and stressful. And this is what bothersome tinnitus is all about. As Karla said, some people have tinnitus and it doesn't bother them at all. It's just in the background, like the sound of a fan or a furnace. But for other people, and probably especially at the beginning, it's highly upsetting. It is very bothersome. So then we have thoughts about how upsetting and how bothersome this is and how unfair all of this is. So those stressful thoughts that we have about our tinnitus, the tinnitus, end up making us even more reactive and having a negative perception to that experience of tinnitus. So mindfulness meditation helps us deal with that kind of stress. Mindfulness meditation helps calm the body, calm the mind, which then as a result decreases the distress that the tinnitus causes. So mindfulness meditation also trains our brain to be okay with that sound of the tinnitus in the background of our life. With mindfulness meditation, we intentionally turn towards this sound, even though it may seem impossible when you are first diagnosed and dealing with tinnitus. Mindfulness meditation helps us turn towards the sound and other things that are happening in our life that are stressful, and be okay, not be so stressed out about these things. And meditation also teaches us to be okay with the sound of tinnitus and to not focus solely on it, which is what we do at the beginning, right? We can't hear anything but the tinnitus. But there are many other sounds in our environment, so we learn how to intentionally refocus our attention to those other things. Ultimately, mindfulness and meditation practices are tools that help us habituate to tinnitus. What it does is it changes our perception and it changes our emotional reaction to the tinnitus and other stressful situations in our life. So the first thing that we do as it relates to mindfulness and meditation with tinnitus is we deal with the biggest problem first. And that is, as Karla said, stress. So you may be thinking that the sound of the tinnitus is your biggest problem, but really it's your reaction to the sound of the tinnitus that is the biggest problem. Hyperfocusing on a sound that creates extreme stress in the body and the mind creates even more extreme stress. So it really is kind of a chicken and the egg. I've been on many Facebook groups where they say my tinnitus has caused the stress, and then people say the stress has caused my tinnitus. Either way, your fight or flight response is triggered, and it might become chronically triggered, and it can be next to impossible to turn it off. You probably can't sleep at night, and then you get up the next morning and you have to start the day all over again. One important study out of the Centers for Disease Control showed that 90% of all illness and disease is related to stress. As Karla said, even though tinnitus is not a disease, it brings an extreme amount of stress into our life. So when we rule out that there are no medical causes for your particular experience of tinnitus, the biggest problem that we need to deal with is the stress. So whether it's the cause of your tinnitus or the effect of tinnitus, it doesn't really matter. What we need to do is to reduce our stress response to the tinnitus sounds so that we can reduce our negative reaction to it, so that we can ultimately learn how to live with it rather than against it. So mindfulness meditation's effect on the body and the mind, which is what tinnitus affects. One of the foundational practices in mindfulness meditation is something called a body scan. So it's a meditation, but it's also kind of an active exercise. And this particular meditation, the body scan, helps us see where and when we're carrying unconsciously tension and stress in our body. But it also helps our body, or reminds our body, of how to relax, how to let go of the negative reaction to tinnitus or any other stressful event in your life, and then remember how to relax. So when you relax the body, it relaxes the mind, and when you relax the mind, it relaxes the body. And dare I say it, we can then, with those two things, become more physically and mentally accepting of the things that cause us to suffer in our life, like tinnitus. There's a very well-known meditation teacher by the name of Shinzen Young, and he came up with an equation about suffering. He says, suffering equals pain times resistance. So the more you resist something painful, like tinnitus, or a divorce, or a situation at work, the more suffering there will be. Resistance is a form of hyper-focusing. So mindfulness meditation teaches us how to be with the challenges of our life more skillfully. And the biggest skill that we learn in mindfulness meditation is to let go of, or at the very least, soften around the things that are stressful, the things that you have to learn to live with because there's not a whole lot you can do about, like tinnitus. So one of the best ways that we can learn about mindfulness meditation is to essentially do a quick one. If you want to do that, we can do a very, very quick, short body scan meditation. And Marta and Karla, you can join in if you like. Essentially, just get yourself nice and comfortable. You don't have to be lying down or anything. You don't have to sit in a pretzel, just sitting in a chair. And you can close your eyes if you like. And we'll just start by using the breath very quickly as a tool to trigger the parasympathetic nervous system. So that's your rest and digest. So breathing in to a count of 2, 1, 2, and breathing out to a count of 4, 1, 2, 3, 4. And once more, breathing in, 1, 2, and breathing out, 1, 2, 3, 4. And now just letting the breath return to its natural rhythm. And now bringing your focus to your body. So just feeling the contact between your body and your chair, or whatever you're sitting on, and just allowing the body and the mind to be here in this moment, just sitting here, nothing else to do. And bringing attention to what's happening around you, any sounds in your environment, including the tinnitus. The tinnitus sound is there, and this is not a problem. Just for this moment, just let it be there in the background as best you can. And now bringing your attention to the different areas of the body that tend to hold tension or stress. And we'll do this fairly quickly. And on the exhalation, just allowing your body to release any stress. So starting at the top of the head, breathing in and breathing out, moving your attention over your forehead, softening any lines there. Moving your attention down over your eyes, softening the muscles around the eyes and the cheeks. Moving your attention to your jaw and just noticing if it's clenched. And on the exhalation, just relaxing the jaw. Moving the attention down the neck, loosening any tightness in the neck. Dropping the shoulders. Bringing your attention to the upper body, both front and back. Noticing any tightness or holding there. Moving your attention to your midsection, front and back. Noticing the rise and fall of the inhalation and the exhalation as it's moving your rib cage. And now moving your attention down to your lower torso, noticing the belly rise and fall with the inhalation and the exhalation. Moving your attention over your upper legs, down over your knees, your shins and calves, and your feet. And now just shifting your attention to your upper arms, your elbows, your forearms, your wrists, and finally your hands. Just noticing, are your hands curled up? Are they clenched? Are they soft and relaxed? And now just sensing the body from the inside out, the whole body, noticing any sensations anywhere, any tightness, letting go of any tension on the exhalation. Again, allowing all sounds to be just as they are in the background. Keeping your attention on the breath. Moving in, moving out, one after the other. And now as we end this meditation, taking a deep breath in and a long, slow exhalation again. And opening your eyes whenever you're ready. So with the body scan as a mindfulness, one of the many mindfulness meditations, what we're learning in that particular exercise is we are learning to, one, put our attention where we want it to be, which is not on the tinnitus, taking in anything that's happening around us and focusing on that, going through the body, noticing if we're holding any tension in our body anywhere, and then consciously, intentionally, on the exhalation, relaxing those particular areas. So this is what helps us process, deal with, and help stress not cause or build up to cause us any big problems. So if you're interested in learning any more about how mindfulness and meditation practices can help you deal with tinnitus, I have 2 programs. One of them is a workshop. So this is specifically for people who are just a little bit curious. They don't want to commit to an 8-week program. And that is called From Panic to Peace, How Mindfulness and Meditation Can Help Relieve Tinnitus. So we'll get into all the basics about meditation, what it is and what it isn't, and how it specifically can help people who are living with tinnitus. And then if you are interested, then I've got the 8-week program called Be Here Now. There's a saying in meditation, be here, as in this place, now. And that helps us live in the present moment. And to, with this particular program over the course of 8 weeks, I'll be able to show you how to understand what mindfulness and meditation is about and how to actually apply it to your day-to-day life. So we'll take you step by step through that. What I do is I usually wait till I get enough people together who are interested, and then I will put on either the workshop or the 8-week program. So all details for those programs are on my website, anchoredmeditation.com. And if you have any questions that you want to email me about, please feel free to do that.
Thank you so much, Karen. I will now take some questions that we have in the chat. So Pastor Chad shared that he leaves the cold water running at night and it helps a lot. That is one of the things people do. You might want to look into a lot of free apps or a sound conditioner, a little device that provides those sounds without wasting water. So if you want any more information about those apps, please contact us. Our contact information will be included on the last slide. So the other question we have is about the cost of the TRT treatment. It's for Karla, and whether or not TRT, CBT, and so on are covered under any insurance policies.
Okay. Yes, so the cost of the TRT treatment, typically the initial testing appointment is about $120. And then after that, there's usually a charge for the 6-month testing and counseling appointment, about the same price. And then at the 12-month visit, the same testing is repeated, so we can track progress, and that would be the same cost. The only other charge would be if the hearing test is required. If you haven't had a hearing test done initially, we would need to do that. That is $60, and the hearing test we like to repeat annually as well.
Okay, thank you so much for this. We had a webinar last year by the creator and founder of Tinnitus Retraining Therapy, Pavel Yastrebov, and I'll share a QR code for other tinnitus and Meniere's disease resources that include that webinar as well. So on this slide, you can see the QR code for other tinnitus and Meniere's disease resources, video resources. Provided by the Canadian Hard of Hearing Association, Newfoundland and Labrador. So if you scan the QR code, you will land directly on our YouTube page with all the resources relevant to this topic. And here's our contact information. So thank you so much for joining us today for this wonderful webinar. Thank you to our speakers, Karla and Karen. And I don't have to tell people now that there's nothing they can do. So now we have specific and very concrete information to give them and to places to send them. So expect the referrals. And for anybody who is experiencing tinnitus, now you know there is an answer, there are things you can do, and please contact these places for additional help. Thank you so much and have a great day.